Marathon runners and colorectal cancer risk. There was a study released in August 2025 that they were looking at ultra marathon runners, and they noticed that there were higher risks of colorectal cancers, polyps, and this is something that I think deserves attention because, interestingly enough, I've noticed the same trend as well. So, I've been in practice now for 25 years as a naturopathic physician with a cancer solely practice in cancer care. And I definitely have noticed this trend of these very lean, fit demographics. So here in Vancouver, British Columbia, there's definitely a lot of really fit and healthy people where, there was also, we were seeing these patients diagnosed with advanced colorectal cancers, and they're in their 40s, approximately, plus and minus. And so something that I noticed was a trend. And at first, I just thought maybe I was attracting a healthier demographic or population, but I've learned that's not true. So, anyways, the study that was just published in August actually puts a significant light in this area that for some reason there's definitely risk in these marathon population groups. So I'm just reading here like just some of the key findings that was found. So 15% of participants had an advanced adenoma, so like those polyps, compared to the expected 1 or 2%, and 41% of participants had at least one adenoma. The average age of participants was 42.5 years old, 2.5 years below the recommended age for a first screening colonoscopy. So again, it was a prospective trial, and just looking at, there's some changes that are occurring quite early in this population groups. But me here in Vancouver, British Columbia, I've noticed the exact same thing. And again, more seeing the advanced disease population groups, like all these patients were missed in diagnosis, being too young and too fit and too healthy. But there's something about this that doesn't make sense necessarily, because they're quite healthy. They could run faster than me. But yet, anyways, there's something about these types of athletes, that there could be a higher risk compared to the general population. So something to keep an eye on for sure.